Hi, my name is Takoya Urbina, and I am the communications manager for PBC Awareness, and you are watching PBC Warriors. And this is another edition of speaking with PBC patients, PBC warriors in our PBC Awareness community. And today we have the lovely Miss Sandy Kazenko, who has volunteered to come on the show. And express her health journey with you all. And I love to bring her up. Thank you for joining us today. We appreciate having you on the show.
Thanks so much for having me. I appreciate it so much. Um, I I have I'm a very recently diagnosed PBC patient, but I recently had been scouring the internet, as I know one does when you first get a diagnosis or when you're suspicious of a possible diagnosis coming. And one of the first things that I came across was your series here, and I've watched all of them, and I can relate to all of them in certain ways. So I really appreciated to bring some comfort. So I'm happy to give my story as well in hopes that it can help somebody else.
We love that. We absolutely love listening to the voices of our community members and allowing you to have the platform to express your own journey with others in the community because like our episodes have impacted you and resonated with you and you were able to connect with them on one way or the other. You're also now doing that to people who are watching this episode with you, and I'm sure that there's someone out there who may have been newly diagnosed and need to hear from someone who has that same experience that they can hear what to expect and
Hmm.
any sort of emotional turbulences that go along with finding your newly diagnosis. I'm sure that you're going to impact them as well. I did want to start with your introduction to the disease. So can you take me back? It's newly diagnosed, but can you take me to that point when you were told that you had PBC? Did you find out because you weren't feeling well and you went to the doctor, or has it been a long process and you were finally diagnosed after suffering from years and no one understanding what was happening to you? How did that come about?
Yeah, so I was only told that I have PBC about 2 months ago. So
Okay.
I'm going to take you back to about 2020
Okay.
when things started happening. So I think I have always been just okay at going to my annual checkup. I wouldn't say I went every year, but I really had started going every year. My husband is really good at that, and he really inspired me to make sure that I go to my annual physicals every year. And another thing that I'm glad I did very early on that I want to mention was and my husband taught me this too, because I think he figured it out along the way, is when you make your annual appointment just to get your annual physical with your primary physician, you should, after you make that appointment, give the office a call, or if you can communicate with them in your portal, and ask for that order for your just your standard blood test before you go. So when you get to your appointment, you can talk face to face with your doctor about your blood test results. Instead of going getting a physical, then they order a blood test, which is typically what happens, and then you go home and you have your blood test later, and then they just communicate with you through the portal, if they even do, because if nothing's wrong, they may not even say anything. So I started doing that around 2020. Yeah, around like 2019, 2020. And I would always get my blood tests. And in 2020, when I went in, my primary physician said, "Huh, your liver enzymes are kind of high. Have you had a history of that? How much do you drink?" And I'm like, "Well, I actually don't really drink. I mean, I'm the type of person who has maybe 1 to 2 drinks, maybe a few times a year when I'm out for a special occasion. And that's it. No, we don't drink at home. It's just not something it's just not our thing. So drinking wasn't an issue. I don't take any type of medicine that would affect my liver. So she said, well, it's possible you just have fatty liver disease, which is pretty common, but that can be fixed. So you just need to lose a little bit of weight, exercise more, maybe switch to a Mediterranean diet. And I'm like, well, okay, I can see that. I wasn't too worried looking at my numbers, how high they were, or if they were very high, just a little high. I just didn't really think about it because the doctor wasn't concerned. So I went that year, came back in. I wouldn't say I really lost any weight, or like, how we sometimes we'll eat better, we'll go on that Mediterranean diet, we'll exercise, and maybe even lose a few pounds, but then we kind of go off the wagon. And, you know, so by the end of the year, I wouldn't say I had that much of a change. But my liver enzymes were high again, and they were higher even than the year before. So now I'm really blaming myself. And this is what I do want like physicians to hear. And um, is that we blame ourselves, as blaming myself that I'm not healthy enough. I don't have a great diet. I was a latchkey kid. I'm Gen X. I grew up on a lot of fast food and microwave stuff. Like I don't have the best eating habits still to this day. Exercise is hard. I'm a mom. I have a kid at home still who now he's in college. Then he was like maybe late high school going into college. I have a daughter who's married and has babies, so we're grandparents. And um my husband also has his kids and from a previous marriage, and we have grandkids there. And like we just have a lot in our lives. And during that time, sadly, my mom passed away suddenly. And then my family, we had to switch to being a caretaker for my dad. And then at the next year, my dad passed away. So, a woman, middle aged, we are called the sandwich generation, and that's really what it was. I was sandwiched between, my parents and my kids and my own job. I work full time, and um, just everything going on. And then you have, menopause symptoms. So, around this time, the second year that my liver enzymes were high, I started experiencing terrible terrible fatigue, and tiredness that just would not go away from sleeping. I have an okay sleep habits, and I still just I couldn't ever get it together. I was just always so tired, the brain fog. And then I told my doctor that, but again, we kind of just thought, well, of course I'm tired with everything that I'm going through and the age that I am, and my body is changing too, and like all of that. So just a lot. We had a lot going on. And so um I decided I just needed to try harder to lose weight, exercise, eat a Mediterranean diet. So now we go back the third year. And the next year, these numbers are even higher. And I thought for sure that they would have gone down. So I had started looking online, and I don't necessarily recommend doing that because I saw a lot of really scary things that, by the way, it turned out to not be some of those scary things. But I never actually saw anything about PBC right away. But my doctor did mention that there was an autoimmune disease that I could have. So I then also started having another symptom, and that was this extreme thirst. Like I would just get so thirsty all of a sudden out of the blue. My mouth would be very dry. And it was, I mean, like I would get up and run out of the room to get water. It was the weirdest feeling. I had never noticed that before. So my doctor was testing for other obvious things like maybe diabetes. You could have that with diabetes. My A1C was fine. She had me do a glucose monitor for a couple of weeks. It wasn't that. So again, um, she's just saying, the doctor's just saying, well, maybe, you need to lose a few pounds and then, exercise better. So I'm going to try that. But I told her, I'm really concerned because when I when I asked Dr. Google, he said that the numbers were higher than they would be for fatty liver disease. Like there, you could have high liver enzymes from that, but they were higher than that. And I said, I'm really concerned. Is there anything else that we can do? And I kind of wish that maybe the year prior I would have said this. Um, I wish that I would have been more persistent because I can see my doctor's point of view. I'm having symptoms that aren't really that severe overall. It's not life threatening. And I also am having like a lot of stress in my life. And, I'm at the age of menopause and all of that. So I don't see, there's a lot of other things that those symptoms could be from. But I really felt that something had to be wrong if these numbers were so high. So she said, fine, let's get ultrasound. So I believe it's called an elastograph, something like that, but it's a special ultrasound where they look at your liver. And I had that, and the results came back. Now, you could be a 0, an F0, which is just a normal, healthy liver, or 1 through 4, and 4 being cirrhosis of the liver, which is definitely, dangerous. And you're talking about maybe liver transplants by that stage. So mine came back as F1 with mild scarring. So the doctor responds in the portal saying, everything looks okay. You do have some scarring, but everything looks okay. And I'm kind of like, well, why though? Why am I F1? Why am I not just an F0 and have normal liver enzymes? Like, I still feel like something is wrong. So I'm feeling a little bit frustrated, not really getting anywhere. And then what happened was I had another issue, and I find out that a lot of times PBC gets really found out because of another issue. And that is what happened with me. So I actually ended up in the hospital with diverticulitis, which is pretty common. It's not uncommon, and it's a disease where it's just where your intestines, some people have like little divots in their intestines, and they can get kind of impacted and infected, and then you get a lot of pain, and some people end up having to have surgery from it. So it's a digestive issue. So I ended up getting diverticulitis. I was in the hospital, and I had that before, but it was a little bit worse this time. And during the most previous year, I did finally lose kind of a significant amount of weight. I mean, I wasn't like too overweight, definitely had some pounds to lose, but I lost, a significant amount medically would be like 30 to 40 pounds. And I did lose that. I was eating better. And I really felt like when I went back to the doctor the next year, which I think I was about 4 months out from my next annual, I was so confident that my liver enzymes were going to be normal now, because maybe that's all I needed was to, lose that weight. And while I was in the hospital with the diverticulitis, a surgeon comes in, and they just kind of assigned me to a surgeon. And he said, good news, I do not need surgery for the diverticulitis. It looks like it's going to heal on its own, but I needed to stay in the hospital for a few days to be on like various levels of liquid diets. Not fun, but that's what I had to do. And he goes, and by the way, do you know that your liver enzymes are really high? And I'm like, oh yeah, I know, but I'm sure they're better now. I wasn't thinking that they just did a blood test that day. I was thinking he was seeing my previous blood test, and I'm like, well, I'm sure they're better now. I've been so much healthier. So, and he goes, no, they're really high right now. And I'm like, wait a minute, what? So I actually logged into the portal myself, and I recommend looking back, especially if you're a PBC patient, looking back at in the portal, you can find a section where you can see charts of every year of certain parts of your blood tests. And so I found all the liver enzymes, and they were going up, 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 up. And I was shocked to see how high they had gotten. So the surgeon in the hospital tells me he wants me to follow up with him in a couple of weeks, just to make sure that diverticulitis was healing, and to talk about next steps and all of that. So I just took that couple of weeks to heal from that issue, and I went back. And I guess while I was in the hospital, they had also found a tiny, tiny little gallstone, which over the years had been seen, but sometimes would even hide, and sometimes they didn't even see it. And I had never had any gallbladder issues of any kind ever. So that wasn't a concern. People can live with a small gallstone, and sometimes it just doesn't cause any problems. So when I walk into my 2 week checkup, he says, he walks in the door and says, I think it's your gallbladder. I'm like, what? What am my gallbladder? He said, your liver enzymes. I think if we remove your gallbladder, your liver enzymes will go down. And I right then and there was stuck in this place where some of us might be sometimes, where I don't I don't like I don't relate to what I'm hearing from the doctor right now, but I also don't want to not trust the doctor because I know that he knows a lot more than I do. I'm not a medical person, but it just something doesn't sound right. I don't get it. And he said, well, and he took a piece of paper and he wrote like some chart showing me, it was like a little biology lesson there in his office, and anatomy and physiology lesson. And he was showing me how the gallbladder can affect the liver. And I'm trying to absorb this, but it was just not really clicking. And I said, well, can I just maybe hold off on getting my liver or my gallbladder? Don't want to take out the liver, my gallbladder taken out. And he says, well, actually, you should do it soon. Let's do it next week. And I'm like, well, how about 2 weeks? So I made the appointment for 2 weeks and I left, and I was not feeling right about it. And I told my husband, he was not feeling right about it either. And he said, I am supposed to follow up with my gastroenterologist about the diverticulitis. And at this point, also about my liver enzymes still being so high. And my husband said, you need to go before you get your gallbladder taken out. And I'm like, I am so tired of all of this. And I have to work. I have things going on. So I didn't make the appointment for a few days. And then I called. And of course, I couldn't get in for like 3 months to see the gastroenterologist. So I made an appointment for 3 months. And I told my husband, well, there just isn't an appointment. But I realized I needed to call and try. So I called and they said, we can't get you in with the doctor, but we can get you in with the nurse practitioner. I'm like, well, I don't know if that's a problem. It seems fine to me. I'll come in. And so I could go in the next day and talk to her. And I had never met her before, but she is one of the heroes in my story, I will say. And I hope she eventually sees this. I'll probably send her the link to it. But she was the first person I felt like really, really paid attention to what was going on with me in the way that I needed, that I didn't even know. So she said, why are you having your gallbladder out when we don't even know what's wrong with your liver? And I was like, exactly. I think that's the language I wasn't really saying, but I was thinking. And she said, we need to do a full liver workup. And here again is where I hope physicians can understand that, like, I did not know that I didn't have a full liver workup, because when I had that ultrasound done, I just said I wanted to look more into why my liver enzymes were high, and the doctor sent me for an ultrasound. I'm not a medical person. I did not know that there was a whole bunch of more blood tests that I could have gotten. That would have been so easy, just to go and get a whole bunch more blood tests that were all focused on the liver and the function of the liver and the health of the liver. There's also an MRI that you can get, where they can also do an MRI and look at your liver. So she sent me for the full liver workup and the MRI. And the liver workup, I didn't even know that there were that many different categories in your blood test to look at your liver. I still cannot believe how many there were. So they started coming into my portal, I would say over the course of a week, and they started coming in like that night. which was really quick. And the nurse practitioner did tell me, don't, which was also great of her to say, because we do get anxiety when we're waiting for results and waiting to hear from the doctor. And she said, don't worry if I don't respond, because I'm not going to say anything until I see everything come through, and it could take days. So I knew she wasn't going to say anything. But I started taking those blood test results, and I'm not sure if I necessarily recommend this because it did work out for me, but I put those blood test results into ChatGPT, and ChatGPT knew immediately what I had. Um, and it knew that I had PBC right away. And then it also said that I had a possibility of an overlap disease. And I'm like, well, what's that now? But it's ChatGPT. It's not a doctor. I'm not talking to a real person, so I'm just gonna kind of hold off. So I went and had the MRI. The MRI came back saying that I this had been like just over a year later from the ultrasound, and the MRI still said that I was at an F1, so that was a relief. I'm still feeling the symptoms though. I'm still extremely tired, and I have some difficult fatigue that I have to deal with, and constantly my eyes are dry like sandpaper, and that problem with my dry mouth as well. But I'm learning to deal with some of that. And the nurse practitioner, I mean, finally responds in the portal, and she says, "We're going to have you see a hepatologist now." But she didn't say what I had, but I kind of knew. So I went to the hepatologist, and when I walked in, I said, "Do I have PBC and AIH, which is autoimmune hepatitis overlap?" And she said definitely that I had PBC, and that it does definitely look like I have AIH as well, but that can only be found from a biopsy. So I had a liver biopsy a few weeks after that, and it did come back that I do have both. So there's another autoimmune disease called AIH, autoimmune hepatitis, that looks like, according to my annual blood tests over the years, it looks like it started about the same time as the PBC did, and which started about like age 49, age 50 for me. It's been 5 years. Um, so now I have two autoimmune diseases that are attacking my liver. And the biopsy results also said that the um, there was a little bit of cell death in the liver, and that's just from the AIH. And then the uh, biliary ducts have some damage from the PBC. So the two autoimmune diseases that I have are both kind of going after my liver in different ways. And it's pretty rare to have both. I don't know why I got so lucky. There is nothing in my family history that I can see that anybody's had. And as people who have researched, why they have PBC, there really aren't a lot of answers. It could be some hereditary and some environmental. So we really don't know. But along with those, the doctor told me that, I mean, the hepatologist told me that there's another autoimmune disease that can also go along with them called Sjogren's disease, which could be the cause of some of the dryness in my eyes and my mouth, but that also could be the PBC. So I'm going to see a rheumatologist about that. Uh, so the way she put it was that the autoimmune diseases always have friends. So if you have one, you might have another or more. So that was very interesting to me. So they put me on the Ursodiol, which I take twice a day. And I've only, like I said, been diagnosed for 2 months, but at the first 30-day mark, I had a blood test again and finally saw my numbers go down. Finally. They actually went down quite a bit, about 30%. Yeah, in just the first month. And I know that they don't really pay attention, I guess, until maybe 6 months. So I think I'm on the right track. So that's good. But during this whole process, it was just, I will say it was extremely scary because, like I said, when you're out there looking on the internet, and one of the things that comes up right away is liver transplant. And, not being a medical person, not being able to really make sense of everything that's going on, that's the first thing that your mind goes to is, wait, I have a lot of plans for my future. I can't have a liver transplant right now. But it turns out that if you're diagnosed early, that it can be a very slow moving disease. And my hepatologist feels even with the AIH in combination with the PBC that it should be a slow moving disease. And I already know that the ursodiol is working. There's other medicines too that I know my doctor is prepared to try or switch me to if needed. So I feel there's two other medications. I know that they're not always the easiest to get approved from insurance, but I didn't have any problems getting approved for the ursodiol. So we'll just see what's to come with that. But for now, I will say that I'm relieved that even though it was 5 years to diagnosis for me, it still is early. And if I wouldn't have pushed or I wouldn't have come across that wonderful nurse practitioner at the gastroenterologist, which by the way, I should have mentioned I canceled my gallbladder surgery that day that I saw the nurse practitioner and I did not have my gallbladder out. And when I went to go see the hepatologist, I was telling her my story, which obviously isn't always in the correct order because I'm just telling it how I'm thinking of it. And I started mentioning my gallbladder coming out, and she went, "No, you didn't get it out, did you?" And I said, "No, the nurse practitioner saved me from getting that out." So I did cancel that, never went back to follow up with the surgeon because I don't need to get my gallbladder out. So my gallbladder is fine and doing great. But yeah, so that's pretty much my story. I just have to see what is to come now. But I do have a lot of hope that at least I know why um, my fatigue and my dry mouth and some of those symptoms. I don't have the itching like they say, like people talk about. Um, Not yet. Maybe I won't ever get it, but yeah, so it was very scary, very uncertain, very frustrating. And now here we are.
Well, thank you so much for sharing your story. You have given so many great tips, especially about setting the blood test before going to the doctor. That's something that I didn't even know that you could do that. So I'm
Mhm.
going to start doing that myself. So thank you for that tip and so many other wonderful pieces of advice for other patients as well as doctors and physicians. I hope that everyone is listening out, and if you have to rewind so that you can get the information and get the advice that Ms. Sandy imparted. Before we head out, is there any way that anyone in our community that would like to reach out to you, would you like to share how they can reach out to you to connect so that they won't feel alone in this journey?
Sure. Yeah, actually, I'm happy to give my email address, which is my name, Sandy with a Y, Kazenko, Kaz as in zebra, Enko at Gmail. I'm very happy to help answer any questions or share any other things that I've gone through as far as this disease. Also, you may see me in the PBC groups on Facebook and on the PBC awareness social media. You can always DM me anytime you see me on there too.
Awesome. Thank you, thank you, thank you, Miss Sandy. If you are in the PBC community and you're newly diagnosed or you just want to connect, Miss Sandy is opening her DMs for others who want to reach out to her. Please take advantage. It's important that we understand that we're stronger when we're together, and that's what we're here for. We're here to educate, inspire, bring awareness of PBC, and to make sure that everyone feels connected and not alone in their journey. Thank you for coming on, and
Thank
hopefully
you.
we'll see you again and we'll be able to interact in other different events and activities with PBC awareness, that this is not a singular event.
Right.
Okay. You have a
Yes.
wonderful, wonderful weekend, and we will stay connected. And please look forward to future episodes that we have with PBC Warriors. We are here to connect, inspire, and bring awareness. Thank you so much for joining us, and we'll see you next time. Bye
Thank
bye.
you so much for being there. Bye bye.